In 3 months, Mexico has received almost 7 million COVID-19 vaccine doses. The first have been administered to health workers and the elderly in 330 municipalities of the country, including 8 in the capital. We have more details in this report with our correspondent, Eduardo Martinez.
Elderly people from the Venustiano Carranza municipality in the center of Mexico City were the first to receive the vaccine produced by Chinese biotech company Sinovac.
This vaccine has the advantage that it can be kept at temperatures from 2 to 8 degrees, unlike the Pfizer vaccine that needs to be kept at extremely cold temperatures, or all the vaccines that need to be applied very quickly, because the period of time between defrost and the administering to patient has to be very short.
In this area of the capital, more than 91,000 doses of the Chinese vaccine will be distributed, which offers advantages over other vaccines from other countries. For example, just one dose is included in each vial.
It helps us to have more efficient handling of the vaccines, because every time we are faced with a multi-dose vial, we can end up with wastage. Here we have the exact amount and there is no waste of the vaccine.
Those who have been vaccinated are confident that they will resume their regular activities soon, or simply be able to see their loved ones. Such is the case of Cristina and her husband Julio, who have been isolated for a year to avoid contagion.
We still need the second dose, but we hope that after 15 days we will have sufficient protection that it won't be so bad if we are infected.
We've met with family or visited our friends. Our family unit has been produced to just the two of us here at home.
The Mexican government seeks to accelerate the national vaccination plan against COVID-19 with the arrival of vaccines developed in China. Sinovac has shipped 1 million of the 22 million units purchased by the Mexican authorities.
These million doses that began to be distributed today, and which will be finished by tomorrow, will provide us with a new daily increase in the number of vaccinations.
Up until March 16th, Mexico has reported more than 1.2 million cases of COVID-19 and over 195,000 deaths linked to the disease. The possibility of access to different vaccine options has generated great expectation among the population.
I have heard these vaccines have great potential. I've heard good things, but I am also cautious. I heard there are Chinese vaccines coming, and they give me hope and confidence to apply to be immunized.
The Federal Committee for Protection Against Health Risks has authorized the emergency use of the Sinovac and also Sinopharm vaccines, who will be sending 12 million doses in the next few days. Meanwhile, CanSino Bio, which performed a phase 3 clinical trial in Mexico, has already begun packaging the first 3 million doses that will be applied to the population at the end of March.